Today we are going to talk about knee joint pain. Why do we suffer knee joint pain, especially when we cross age of 50 years? Most commonly women suffer from it because of the menopause. Hormonal changes lead to the change in metabolism of certain minerals, especially calcium. But in general, osteoarthritis is a condition of degeneration of the joints. Normally, if you see the knee joint, when we are using the knee constantly, because of that wear and tear, this cartilage, which acts as a cushion between the two bones, becomes thinned out. And when this thins out, the process of chronic inflammation or the immune system gets activated, and it releases a lot of chemicals into the joint capsule. The whole joint is covered into a layer of joint capsule or synovium. Inside that there is a fluid called synovial fluid. So a lot of chemicals are released by body's immune system, especially macrophages, T cells, that are further damaging the joint. They are trying to repair the joint, but in that process, due to degenerative process, they end up causing more damage to the joint. That is why it causes a lot of pain, it causes difficulty in moving, and as the problem increases, you would find that when we do X-ray, you can see in the X-ray, the space between the two bones gets thinned out, and you see new bone formation, which is a very sclerotic abnormal bone formation happens due to degeneration. It is trying to repair it, causing more and more friction in the joint. That leads to pain. That is the main basis of osteoarthritis, where the process of chronic inflammation initiated by our own immune system leads to all these pains, and as the grade increases. Now, how do we define grade? Is as the space between the two bones gets reduced and new bone forms, grade 1, 2, 3 and 4 we do.